Hi, my name is Jessica Rupp, and this is my heart disease prediction data dashboard. And I got my data set off of Kaggle.com. It's called the Heart Failure Prediction Dataset, and it has a usability score of 10.0, so I didn't really have to do any manipulation with the data. And there were 11 columns given to me. The 11 columns are the age, sex, chest pain type, resting blood pressure, cholesterol, fasting blood sugar, resting ECG, max heart rate, exercise, angina, old peak, ST slope, and heart disease. And I did use the age, sex, chest pain type, resting blood pressure, max heart rate, and exercise, angina, and heart disease. The other columns I did not use. I didn't really find any correlation in the data set between heart disease and those columns, so I did not use them. And then for the heart disease one, I did kind of manipulate it. For the 0, I put that was normal, and then for the 1, I put that was heart disease, just because it made labeling a little bit easier. And so for my dashboard, I have the sex of the individuals, the age of the individuals, heart disease, chest pain type, if they have chest pain while exercising, the number of individuals, a little key for the chest pain type, just so people know like ASY is asymptomatic. The max heart rate is listed down here, and then the resting blood pressure and the number of individuals that have that number on the side. And so what I wanted to do with this data set was see if there was any correlation between heart disease and the sex of the individuals, or the chest pain type, or the age, or if they exercise and have chest pain, or the heart rate, or if the resting blood pressure plays a factor. And based off just this, with all individuals and all sexes included, more than half the people did have heart disease out of this data set, and a lot of people did have asymptomatic cases. And then a lot of people did not have chest pain while exercising, and the heart rate is pretty, there is really no pattern to it. And the resting blood pressure is pretty, no pattern either. But then if you look at just the heart disease, a lot of people who had heart disease out of this data set were asymptomatic cases. And a lot of those people did have chest pain while exercising. And for the heart rate, it's pretty, there's really no pattern to it. And then for the blood pressure, there's really no pattern, to it either. There we go. But if you look at the males, sorry, there we go. A lot of the males did have heart disease. In fact, about 63% of them did. And out of those heart disease cases, a lot of those cases were asymptomatic. A little less than half the people did have the typical chest pain, but a lot of people had asymptomatic cases or had non-anginal pain. But then again, a lot of those people who did have heart disease also had chest pain while exercising, which is pretty interesting. Only a few didn't. And then for the heart rate, again, there's no pattern, nor for the blood pressure. And then for the normal cases, a lot of the normal cases were atypical chest pain, with a few being asymptomatic, but most of those people did not have chest pain while exercising. And once again, the blood pressure and the heart rate were had no pattern to it. And then for the females, overall, there's more chest pain type. Well, asymptomatic cases, were the biggest group. Following just behind it were actually the atypical chest pain or the non-anginal chest pain. But once again, the typical chest pain was pretty slim. And a lot of the females were actually normal, with only about 25.91% of them having heart disease. And out of those heart disease cases, a lot of them were actually asymptomatic. And a lot of those people who were asymptomatic also had chest pain while exercising. And then for the normal cases, a lot of the normal cases had, actually typical chest pain, but also, non-typical chest pain or non-anginal pain. And a lot of those people did not have did not have chest pain while exercising. And then if we look at all sexes, but we limit the age to younger individuals, probably below 50. A lot of the younger individuals were normal, with about 39% of the individuals having heart disease. And once again, asymptomatic cases led. And for the normal ones, a lot of the normal ones had atypical chest pain or, non-chest pain. And a lot of those people did not have chest pain while exercising. And for the people who did have heart disease, a lot of people did have chest pain while exercising, and a lot of people were asymptomatic initially. And then for the older individuals, we'll go 51 and above. A lot of those people actually did have heart disease, and a lot of those people, once again, were asymptomatic. So out of the heart disease cases, once again, asymptomatic led, with a little tiny bit of people having, the typical chest pain. And a lot of those asymptomatic cases that have heart disease did have chest pain when exercising. And then for the normal ones, a lot of the normal ones were atypical chest pain, and a lot of those people did not have chest pain while exercising. And so looking at all of them, once again, it is just kind of like interesting to see. And then for and so what I kind of determined based off this is, as I thought, was that males, are more inclined to have heart disease than females. And then also the older generation is also more inclined to have heart disease than the younger ones. But what was really interesting was a lot of cases that were, indicative of heart disease were asymptomatic, which is kind of scary because they did not have the typical chest pain. They actually had no chest pain at all. So that was kind of really interesting to see. And then also the heart rate and the resting blood pressure didn't really play a role in correlating with heart disease or not, but it still is nice to look at just in case. But then also for the exercise chest pain, a lot of people who did have chest pain while exercising did end up with heart disease. And so that was a nice correlation, because what I actually do for my daily job is perform stress tests at a local hospital to see if a person has heart disease or not. So it was really interesting to visually see that, that people who do have chest pain while exercising do actually typically end up with heart disease. And so for me, it was kind of interesting to see visually that what I know on a day-to-day basis and what I've experienced actually can be confirmed with this data set. And I can actually visually see that what I know and what I've been taught on a day-to-day basis actually is true. And so what we can go with this data set is probably, analyze more of the columns that I did not include, like, the old peak or the ST slope, or even the fasting blood sugar or cholesterol. But yeah, otherwise, I feel as though we just need more individuals in a bigger data set in order to make, more correlations and maybe having some more factors in play. But overall, this is my heart disease prediction data dashboard, and I hope you enjoyed this presentation.